Coming up on Bloom, how curing a leaky gut can help you conceive.
Gut health sometimes gets looked past when a lot of times we want to blame the hormones or something else causing the infertility. But if we don't assess the gut health first, that's our true foundation.
And we're making a salmon sunshine bowl loaded with nutrients that can help boost fertility. Plus, how the ancient art of acupuncture can relieve stress and anxiety. We'll have all that and more as Bloom, presented by Lifeguard Imaging, starts now. I'm Gayle Guyardo. Welcome to Bloom, presented by Lifeguard Imaging. 1 in 6 people globally are affected by infertility. And even if you're not trying to have a baby, what you'll learn today will change your health for the better. Because here's the thing, medical intervention is only a small part of the equation. Couples spend tens of thousands of dollars on IVF or in vitro fertilization, but without addressing other health concerns, the chances of conceiving decrease. So today, we're turning to the experts for medical advice that will help you whether you're trying to have a baby or not. Joining me now is chiropractic physician Dr. Rachel Wolf and fertility coach and the author of Her Infertility Success Series, Erica Hoke. Ladies, thank you both for being here today.
Oh, thank you, Gayle.
Thank you for having us.
So Erica has set up a great show for us today. We've collaborated now for months putting this together. You're bringing us the experts because you found out through your own personal journey how much it can help to get whole body healing.
Yes, absolutely. You know, I was not a candidate for IVF at 35. I was told that I didn't have enough eggs, they couldn't do a retrieval, and that I had less than a 1% chance of getting pregnant. So the things that I teach and the people that are here today are the type of people that I collaborated with in order to change my health and address the root cause issues for a lot of my diagnosis and diseases. I had 7 different diagnoses. I think that's important to mention because some people think, oh, well, she was only 35. That was her only problem when it comes to infertility. But I also had endometriosis, I had fibroids, I had thyroid issues, I had factor V Leiden. I had a lot of different things going on, but I still was able to change my health and get pregnant not 1 time, but 4.
Which is incredible. So doctor, talk to me about things as simple as a leaky gut, which so many Americans have. You know, our gut health is in shambles.
Yes.
And you say there's a direct link to infertility.
Yes, absolutely. Leaky gut is something, so first to understand the concept more of leaky gut, it's when the integrity of the intestinal lining becomes compromised. So our bodies are very smart and we should have a very strong intestinal lining full of mucus. But what happens is when we are continually exposed to chronic stress and toxicity and chemicals in our environment and medications and things like that, the integrity of that gut lining becomes compromised, and where we should have these cells that are very close together, they should be linked so that there's not really room for anything to go in between. With the stress that I mentioned, those cells start to swell. So as those cells start to swell up, it ends up opening up gaps right between those cells. Hence the name leaky gut. That's where you now have kind of like a leaky channel in between those cells. And so for example, let's say we're eating like a steak, right? And if we're not breaking down the protein in the steak as well as we should be, we now have an opening in the intestinal lining that allows those food particles to slide right through. And that is where it enters the bloodstream. And that's where food allergies actually come from. Our immune system's designed to attack anything that looks foreign, right? So in the bloodstream, if all of a sudden we have these food proteins that shouldn't belong there because they should not have came through to begin with, now the immune system's creating antibodies after antibodies, essentially attacking it, thinking it's something that's a threat to the body, and is trying to get rid of it by causing inflammation. So by eating these foods, even if they're healthy foods, we could be continually really disrupting the immune system and causing this heightened response. And now we end up with autoimmunity.
I want to reiterate for this show, because if you're watching today and you're thinking to yourself, hey, I'm not even trying to have a kid, what's really important to remember here is that healing the body, everything that you would do on your journey towards fertility is going to, you say you're in better health today, Erica, than you were before you tried to conceive for your 4 kids.
Yeah, absolutely. You know, if I didn't heal myself in order to get pregnant, I wouldn't be able to help my children have a healthier lifestyle. You know, I would be a much sicker person. I think that you can see that with my 7 diagnoses already, that I was on my way to a path of being on a lot of prescriptions potentially and not very good health. So.
And Dr. Wolf, you must see this day in and day out with your patients.
We do. It is becoming so common. And I think gut health sometimes gets looked past, when a lot of times we want to blame the hormones or, you know, something else causing the infertility. But if we don't assess the gut health first, that's our true foundation for overall health and especially the immune system. And when it comes to fertility and really sustaining and creating a healthy pregnancy, the immune system has to be in tip-top shape. And if there is that hyperactive response, that's where a lot of couples end up struggling to conceive.
Is this something that patients should start thinking about before trying to conceive?
Absolutely. I think if we all took a more proactive, preventative approach to health in general, the infertility statistics could be so different today. But I think so many times it is a reactive approach that's taken with health, where until we realize that a couple may be struggling or anyone is struggling with a health issue, that's when we go to try to fix it and figure it out. But if we do start educating women and men even very much younger, I think we could prevent a lot of couples from going through so much heartache and so much struggle with conceiving.
Well, I really, first of all, I really appreciate you taking time out of your schedule to, be with us today. Erica, I know you've lined up all of these incredible experts that we're going to be talking to that will help us along for those who are trying to conceive. But again, this show is for everybody because it's going to help your overall health. We're going to share Dr. Wolf's advice on BloomTampaBay.com. And when we come back, clinical nutritionist Lena May is joining us with foods and supplements that support fertility, including a salmon sunshine bowl.
What we eat is going to impact our hormones, it's going to impact our gut microbiome, how we feel. We need lots of nutrients, antioxidants to help us conceive a baby. So food plays a big role. We need fiber, all of those. Also, women need a lot of optimal protein intake.
There's something called the fertility diet pattern, foods you can eat to help you conceive. But we want to reiterate, whether you're trying to have a baby or not, what you'll learn today will improve your overall health. Joining me now with foods that boost fertility is clinical nutritionist Lena May. Lena, welcome to Bloom.
Thank you.
So you've got some great foods here that will boost a woman's chance of conceiving. And how do foods play into this?
They play a big role because what we eat is going to impact our hormones, it's going to impact our gut microbiome, how we feel. We need lots of nutrients, antioxidants to help us conceive a baby. So food plays a big role. We need fiber, all of those. Also, women need a lot of optimal protein intake because that also supports healthy hormonal balance. So, yeah.
What are we putting together today? It looks like some salmon's the main event.
Yes. So we're putting together salmon sunshine bowl, which I thought is perfect for Florida. Why I called it sunshine, we want to include the rainbow of colors. This is where we get lots of nutrients from all different foods. So we have green spinach, it's a leafy green, it's loaded with iron and folate you need for some healthy conception.
And what's the base there that you put the spinach on?
Yes, so this is quinoa.
Okay.
And you can cook it, you can buy frozen. I know everyone's busy eating on the go, so you can make it as quick as possible too. So we take a base salmon, we can also do greens as a base, and we have some purple cabbage. Anything if you think purple cabbage, blueberries, they're loaded with antioxidants, so that helps reduce inflammation, oxidative damage, support healthy fertility. So those are incredible. And the more colors you can add to your plate, the better. You're getting lots of variety of nutrients. Then we have some tomatoes. There's yellow and orange. Tomatoes are loaded with vitamin C too. We also have some bell peppers. You know, a lot of people think of oranges as high source of vitamin C, and it's true, but bell peppers are loaded with vitamin C, and they have even more. So we're gonna put some bell peppers, like add a nice crunch and some of that sweetness we're looking for. We also have a surprise ingredient, you wouldn't think about it, but sauerkraut. It's a raw and live sauerkraut. It's loaded with healthy probiotics and K2, which is also super important for healthy microbiome. Healthy microbiome will support and help with hormonal balance, will help with the conception.
Is sauerkraut a fermented food?
Yes, yes. Yep.
And you hear a lot about the importance of getting fermented foods into your diet.
Yes, absolutely. Fermented foods provide you those key probiotics that help nourish your gut microbiome. It's going to support your immune system. They also found in research studies that a lot of women who are struggling with gut issues are also struggling with fertility. So this is excellent way. Even just 1 tablespoon provides almost 50 billion of probiotics. So this beats any supplement any day. And then we have salmon, like you said, the star show. We do want to do wild caught seafood. Salmon is also really, really high in omega-3 fatty acids, so that also help bring down inflammation. But also a lot of people don't know about salmon is really high in CoQ10. And what I've seen in clinical studies and just in my work, a lot of women who are struggling to conceive are low in CoQ10. It's an important antioxidant that we need. So we add in some salmon, so that's gonna give you lots of good amino acids, help you, give you satiety. And you'll stay full for hours with salmon too.
And then you're a big fan of the avocado.
Yes, yes, I love avocados. They are very nutrient dense foods. They get lots of fiber, they have lots of good nutrients to support potassium. So we're gonna put some on the top. And really you could put whatever you like on the top. You could do hummus, which is loaded with fiber. You can also do just a simple salad dressing, whatever you have in the fridge. Just make it simple, you know, put it together.
This looks amazing.
Yeah,
thank you so much for putting the beautiful sunshine salmon salad together. And you can watch us put this recipe together on bloomtampabay.com. And when we come back, find out about commonly overlooked blood work that could be keeping you from conceiving. Bloom, we'll be right back. You're watching Bloom, presented by Lifeguard Imaging, saving lives through early detection. Call now 813-582-5222 to schedule your scan today. Welcome back. It might surprise you to know simple screenings like blood work are often overlooked by fertility doctors. So we're arming you with the knowledge you need. Joining me now is board-certified reproductive endocrinologist Dr. Celso Silva and fertility coach and the author of Her Infertility Success Series, Erica Hoke. Thank you so much for being here.
It is great to be here. Thank you.
So, Doctor, talk to me a little bit about the blood work that can be overlooked by some fertility doctors.
Gayle, this is a great question. I think that it is important to frame what the situation that you're dealing with. And I think a good example of that are patients with unexplained infertility. And unexplained infertility, it just means that the workup, the traditional workup that you have done has not yielded any test result that justify, the patient case. And that does not mean that a problem does not exist. It could only mean that the test is not able to detect what the problem is. There are a few examples of that. You can have patients who have, for example, fallopian tubes that have tubal transport problems, even if the fallopian tubes are open by traditional testing. You can have patients who can also have other types of scenarios where if the testing does not indicate, you label them as infertility. When this is present, I think it's important for you to start to think outside the box. And this is where extra testing, tests that are commonly overlooked, could be very helpful. For example, there are other scenarios where even if the traditional test does not reveal a problem, you can identify issues by performing these additional testings. Thyroid abnormalities, especially those that are associated with autoimmune conditions, are very important. Certain infections that can be overlooked as well are very important. Coagulation disorders that are also called thrombophilia, like factor V Leiden, MET-HFR, are frequently overlooked in this workup, especially in these patients who have unexplained infertility that do not have an answer for their problem just yet.
And Erica, this is really important to you to highlight experts and doctors in your book series, because you feel, just as an individual and now a fertility coach, that a lot of couples could conceive if they have the right guidance.
That's right. You know, Dr. Silva is one of the great doctors that will dig a little bit deeper, but that's not everybody's method of operation or specialty. And so sometimes with unexplained infertility and with failed procedures, that's the end of the road for that couple with that doctor, or they keep going and they have procedure after procedure that are unsuccessful without looking any deeper into these factor V Leiden, things like ureaplasma and that sort of thing. So we really want to bring awareness so that if a client does have unexplained infertility, that they are not having success with procedures, that they can ask for this testing or know what to look for if they choose to get a second opinion.
Yeah, and Dr. Silva, talk to me more about that, because Erica herself was not a candidate for IVF, but she was able to conceive with only a 1% chance, 4 beautiful children. And I think it's important to have a doctor like yourself who's willing to peel back those onion layers, and if you're not finding it at the first pass, you're going to keep diving deeper, which is really what our healthcare system needs to be about for all of us, whether we're trying to conceive or not.
Absolutely, Gayle. I understand that the fertility journey is a very difficult journey for every woman, for every couple. It is a situation where women, especially, they have a sense of loss of control, right? Most women, they are in control of their lives, they do what they wanted to do, and when they are facing infertility, it's hard for them not to be able to be in charge of that. And when you are facing these difficult cases where traditional treatments have failed, the initial approaches have failed, I believe what is very important, it is a very open discussion between the physician and the patient. Because it is through that you're going to be able to do what you just said, you know, start to peel those extra layers. Because sometime underneath that is where you're going to find the underlying problem. And without this interaction, sometimes there is a lot that is lost in translation. And unless the physician is also open to hear what the patient's concerns are, what it is the patient bringing to the table as far as her own experiences, you're not going to be able to start to think outside the box like I mentioned earlier, and you end up perhaps cutting short this patient's journey toward a successful conception.
So, Erica, in closing, you believe you need a doctor like Dr. Silva who's going to be open to having a patient come in and say, hey, I read this in this book. What are your thoughts?
Absolutely. You have to have a collaborative relationship, and you have to have that comfort level of being able to have that two-way conversation. And especially if you're having procedures that are unsuccessful, right? That we know that that's the definition of insanity, is to keep doing the same thing over and over again. Yet when it applies to infertility procedures, I see that very often with my clients, is that there won't be a change in protocol, there won't be any change at all, and they just keep doing procedure after procedure. And that's what we're trying to arm the consumer with knowledge about, is that you do have some choices. There are some other paths to take, some other questions to ask. We don't have to just settle for
status quo.
Right,
yeah.
For the status quo.
All right, well, thank you so much, Dr. Silva. We appreciate, I know you're a very, very busy man, and we appreciate you coming in and sharing your knowledge with our Bloom viewers.
Thank you so much for having me, Gayle.
All right, and we're going to share this advice on bloomtampabay.com. And when we come back, an anti-inflammatory diet can help boost fertility. We'll tell you about how it helps patients dealing with autoimmune diseases when Bloom returns.
The following portion of Bloom is sponsored by Gulf Coast Rheumatology.
Welcome back to Bloom. Many diseases and conditions can cause chronic inflammation and joint pain. While medication can help, diet and lifestyle are key factors you can control. Joining me now is board-certified rheumatologist Dr. Monica Shaw with Gulf Coast Rheumatology. Dr. Shaw, welcome to Bloom.
Thank you for having me.
So talk to me about inflammation, the different types, and how it affects our bodies.
Absolutely. So inflammation is the body's innate response to help protect it against something foreign or invading. This can be pathogens, this can be irritants, this can be infections. And when we think about inflammation, there's two different types. There's acute inflammation, which is the short-term response to help fight and heal off things such as infections, bites, or burns. But when we think about chronic inflammation, this is the body's response to chronic inflammation over an extended period of time. And this has been linked to a variety of symptoms such as fevers, fatigue, joint pain and swelling, abdominal pain, bloating, skin rashes, mood instability, or cognitive dysfunction. So it can present in a variety of ways. And what it's important to note is that chronic inflammation has been linked to very, very serious health conditions. So I think it's important to have the discussion, the understanding, and then implementing healthy lifestyle choices, because we know this can help prevent inflammation and prevent chronic illnesses.
And it's also important to visit experts in this field like yourself at Gulf Coast Rheumatology.
Absolutely. I think when it's necessary, a medical provider will be able to help give the knowledge to the patient to make the best choices for their underlying health conditions.
And what I think is so cool about you as a doctor is that you treat patients traditionally, of course, but you educate your patients about the importance of the foods that we eat. They're very healing, especially when it comes to reducing inflammation. And you say we need more fiber in our diets.
Yes, so the standard American diet only comprises about 15 grams of fiber a day, and the American Heart Association recommends about 25 to 30 grams. So we're in a severe deficit. Now people think, where are the sources of fiber that I can obtain? And so these are examples of a variety of different places fiber can be found. You can see it in fruits and vegetables, you can see it in nuts, beans, and legumes. And so what fiber does is it increases short chain fatty acids, which we know are protective to the gut barrier. It can help regulate blood sugar, and also it can help increase satiety, which can lead to weight reduction. So there's a lot of good benefits to fiber.
All right, what about this food group here?
These are omega-3 fatty acids, another essential part of the diet. And so a variety of sources of omega-3s include salmon and fish, such as shrimp. You have quinoa, you have flax seeds, and walnuts is another great example.
All right, a lot of buzz around turmeric and, of course, ginger. I mean, this dates back thousands of years when it comes to the healing powers.
Absolutely, and it's all worth the hype, and it has proven in science to have benefits towards regulating the immune response. And so these components have bioactive ingredients. For turmeric, the bioactive ingredient is curcumin, and for ginger, there's shaw galls and ginger oils, which are bioactive components that work on the inflammatory cascade to help reduce inflammation.
So when a patient comes to you at Gulf Coast Rheumatology, it looks like you're looking at them as a whole to help them heal.
Absolutely. Science has shown and proven that diet can help not only reduce inflammation, but provide a variety of health benefits to help improve the immune health, improve joint health, improve cognitive health of the heart. So really there are a component of varieties in terms of where inflammation and diet can link.
Well, I have to say, I think it's very forward-thinking at Gulf Coast Rheumatology that you're treating patients traditionally, but you're educating them along the way, which is so critically important. So thank you for coming and sharing all of this wealth of knowledge with our Bloom viewers.
Absolutely, it's my pleasure. Thank you.
Thank you. And for more information, visit gulfcoastrheumatology.com, and we'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Gulf Coast Rheumatology.
You're watching Bloom, presented by Lifeguard Imaging. We begin where your checkup ends. Call now 813-582-5222 to schedule your scan today. Finding balance in life while trying to conceive isn't always easy, especially if you're experiencing infertility issues. That's why many people are turning to the ancient art of acupuncture for help. Joining me now with how traditional Chinese medicine can boost fertility is acupuncture physician Dr. Martha Huey and fertility coach and the author of her Infertility Success Series, Erica Hoke. Ladies, thank you both for being here.
Our pleasure.
Thanks.
And Erica, you credit Dr. Huey for helping you conceive.
I absolutely do. You know, I was going about 3 times a week for fertility acupuncture before I conceived my first son. And I will say, I was not a fan of needles before I started acupuncture, but I think that that's something that keeps people away from acupuncture. But I want to assure everybody that it's very relaxing, and you can't really feel it as much as you would imagine in your mind.
Yeah, you don't feel it at all. And I was sharing with Dr. Huey and Erica that I lost my first baby through an ectopic pregnancy, and this was recommended to me years ago. And I found it to be so beneficial. Doctor, how does it work, and how does it help support fertility?
Well, this ancient medicine has a long history in working with all of the body's issues, including infertility. And the people ask, how does it work? It achieves balance. It reboots the computer so the body is able to receive and conceive. And so if there's an excess or a deficiency, the acupuncture and the Chinese herbs bring the body back into balance and reset the structure in order to achieve conception.
Now, I know when you originally started, your business was called Acupuncture Anywhere. You're based out of Sarasota. It's because you would treat not just for fertility. It's great that you are an expert in this area, but you know, today we're talking about how whether you're trying to conceive a child or not, the journey to doing so will bring you into overall health, and acupuncture does that for so many people in so many different ways.
It boosts the immune system, it balances all the organic functions, the GI, the heart, the mind. And at this moment, I would like to say a very special thank you to my colleague and professor, Dr. Gayle in Sarasota, Florida, who is a fertility specialist, a Western OBGYN, as well as a TCM doctor. And my success, I credit to her directly.
That is so beautiful. And I should say, you know, when I went through this treatment all these moons ago, it was a Western medicine doctor that was doing acupuncture on me, but she believed in that balance of East and West medicine, because really this has been proven for thousands of years.
Millions upon millions of cases, and they wrote everything down. So we have the records, and that's the advantage. We live in a day and age where we have the banquet table. We can have East and West medicine for the benefit of the patient.
And for you, Erica, Western medicine alone is not what got you pregnant. You had to go through your own personal healing journey, and throughout your series, you share the wealth of knowledge that you personally learned along the way.
Yeah, absolutely. You know, I do not believe that without any one of the pieces, including acupuncture, that I would have been able to conceive. And I do just want to mention that many reproductive endocrinologists now either have an acupuncture doctor in their office for both before and after procedures. But yes, we are now seeing, you know, with the fertility doctors, that they are embracing both Eastern and Western medicine.
And Dr. Huey, is it true you're the godmother to one of Erica's beautiful
one of the boys there, yes.
So that must mean a lot to you, that what you do helps people in such a way that they want to give you a piece of their child to overlook, because you help bring that child into this world.
Well, this is the joy of my kind of medical practice. I've seen babies before they were walking, coming in through the basket after we help them be conceived and deliver. And I've seen some of them graduate from high school now. So it's been a joyful practice.
And we have just 30 seconds left, but I know you talk to your patients about acupuncture and some of the pure, you know, tinctures and vitamins and things that people can take.
Right. It is a holistic practice where we work with food therapy, exercise, massage, meditation, herbs, acupuncture, and sometimes surgery if there's an endometriosis issue. But these are some of the older varieties of medication as far as being in a liquid or tea presentation, and these are the newer presentations of pills to help women conceive.
Dr. Huey, thank you. It's such a pleasure meeting you.
My great pleasure to be here.
Erica, once again, thank you for the introductions today.
Thank you.
And we're going to share this story on bloomtampabay.com. And when we come back, we're having an extended conversation about fertility and answering some of your most commonly asked questions. But first, it's time for today's Bloom Trivia question, true or false? Infertility affects men as much as women. We'll have the answer later on Bloom. We're back answering your questions about infertility with fertility coach Erica Hoke, chiropractic physician Dr. Rachel Wolf, and board-certified reproductive endocrinologist Dr. Celso Silva. Great having you guys. This is going to be an awesome discussion today.
Thanks
Absolutely.
for having us.
Thanks for having
So,
us.
Dr. Silva, let's start with you. You're one of the leading fertility doctors here in the Tampa Bay area, and our first viewer question is, can you have regular periods and still be infertile?
Absolutely, Gayle. What regular periods usually means is that patients are ovulating also on a regular basis. However, lack of ovulation, which we call anovulation or irregular ovulation, is not only the only cause of infertility. We can have patients who have infertility for a variety of the other reasons that is not associated to ovulatory problems. And we also have the male partner as also potentially contributing to their inability to conceive.
Okay. All right. This next question has to do with food. So, Dr. Wolf, we'll let you pick this one up. Can what I'm eating really make a difference in whether or not I get pregnant? And, you know, this is something you strongly believe is going to boost fertility.
Yes, absolutely. So when it comes to food, that's where there's no one diet that works for everyone, and that's what I'm always telling my patients. There's no perfect way of eating. Every single person is designed very uniquely, and we need to be eating for our own body. So that's where in our clinic we run food allergy testing, where we're really looking at those delayed, in-depth food allergies that are called IgG responses. And if you're eating food that's healthy, but your immune system's responding to it and creating an antibody response, thinking it's like a threat to your body, as healthy as that food may be, it's still going to cause inflammation. And that could definitely then affect fertility.
Erica, as a fertility coach, this question is perfect for you. Why do some people have to pay so much attention to the products they use to get pregnant, while others can get pregnant with a poor diet, and you hear that question a lot, like, I'm doing everything right and this person's doing everything wrong and they're pregnant?
Yeah, I think it's twofold. I think that some people, because of their genetic makeups, and I think Dr. Silva and Dr. Wolf would attest to this, that they have a higher inflammation response than other people, things like MTHFR and just other genetics that come into play. And then also, I think that a lot of people just don't give it enough time, right? We're an instant gratification society, and so you really need at least a minimum of 3 months of being actively engaged in that diet or supplements or those lifestyle changes for it to actually make an impact.
All right, Dr. Silva, I want to ask you this question because we brought you here because you are a doctor willing to think outside the box and work with each patient individually about their concerns and hear them out. And one viewer wrote in and said, all of my tests are normal, but I still can't get pregnant. Why?
Yeah, it is, it is a great question, and it's probably one of the most important challenges that we face in our practice. This concept that all of my testing is normal has to be really framed to a situation where you have to understand that a lot of the tests that we do are quantitative analysis. They're not really qualitative analysis. They cannot really tell much about functionality of certain things. I think one of the best examples of that is the semen analysis for the male partner. Semen analysis is, literally a numeral evaluation, a quantitative evaluation of the sperm. But the functionality of the sperm, it's not assessed by that. And unfortunately, we really do not have an easy way to assess functionality of the sperm. For example, you do have couples that are not conceiving due to fertilization problems. These are situations where either because of an egg problem or a sperm problem, the sperm cannot penetrate the egg and therefore fertilize the egg. And unfortunately, in our toolboxes, we do not have a test to assess that functionality. And I think this is the type of scenario that you do really need to start to think outside the box. You do really need to go one step further and not stop at the basic evaluation, because that perhaps will kind of shut down patients, will make them very discouraged about their fertility journey. So going one step further, thinking outside the box, I think it's very important when my tests are normal, why I'm not getting pregnant.
And one quick follow-up question for you, Dr. Silva. A viewer wants to know, my IVFs didn't work. When should I get a second opinion?
Gayle, I'm of the opinion that you should get a second opinion every time. You know, every time that you feel that you were not answered, every time that you feel you did not have the results that you're expecting, I think a second opinion is very important. Not necessarily the patient, when they go for a second opinion, they will decide to change providers. But for me, the most important thing about a second opinion is empowering, you know, this woman, empowering these couples to continue their fertility journey. If they are hearing different opinions, or if they are hearing an opinion that actually goes in favor of what they have heard before, that truly kind of give them a sense of comfort to continue, you know, their fertility journey.
Dr. Wolf, we don't have a lot of time left, but can inflammation play a role in keeping a couple from getting pregnant?
100%, it definitely can. It's definitely a sign that there's something deeper going on, whether it be hormone imbalances, gut imbalances, immune dysregulation, and it's definitely worth looking into in order to have optimal conception and, you know, fertility outcomes.
All right, Dr. Silva, Dr. Wolf, Erica, thank you guys. This has been a great conversation, and we appreciate all of you.
Thank you.
Thank you.
And we're going to share this with you on BloomTampaBay.com. We'll be back with more Bloom right after this. Living the Tampa Bay lifestyle means enjoying the sand, sun, and outdoors fun. So get out, get active, and nurture those healthy habits. Hey there, I'm Gayle Guyardo, host of Bloom. Now there's a new all-inclusive place with everything you need to shape your lifestyle, boost your health, and improve your wellness. BloomTampaBay.com, Tampa Bay's premier health and wellness website, made to help you feel good. Whether you're a fitness fanatic, beauty buff, or just want to take your first step towards positive change, this free website is for you. See the Bay Area's hottest fitness products, the latest workout crazes, and learn nutrition tips from the experts. Plus, discover local events and experiences designed with your well-being in mind. Cultivate a healthy mind, body, and soul. Check out BloomTampaBay.com, your local health and wellness website. That's BloomTampaBay.com. Life traumas and anxiety can play a big role in keeping couples from conceiving. Joining me now with ways to release that stress is somatic wellness specialist Suzanne Gunderson and the author of her infertility success series, Erica Hoke. Ladies, thank you so much for being here.
Thank you so much.
Thank you.
So Suzanne, I really admire your line of work. I've had somatic healing myself, and it was really groundbreaking for me on a personal level. And you say holding on to past traumas can keep people even from conceiving.
Absolutely. I mean, the body is capturing a state of overwhelm and is stuck in that, almost like a freeze response. So that way we can't move forward to be able to reproduce, do normal body functions. We need to be able to have a regulated body. And so somatics and anything that helps the body to relax and calm down and feel in more of a state of at ease helps the reproductive system and conceive naturally.
Now, can you explain to our viewers exactly what somatic healing is? Because there's, you know, that book, The Body Keeps the Score, and it does.
Yes. So we have an amazing stress response in our body. When we are relaxed, our body is behaving normally. Normal functions are happening. We blink, we reproduce, we swallow, we digest. All these things that we don't have to think about are happening for us. But when something comes into our neuroperception of our body's experience, we begin to rise into a threat response. And the body squeezes in and starts to react. And all the blood leaves our viscera and it goes out to our limbs to literally fight or flight. That's what it means when we're saying fight or flight. And it can be a very hot, anxious experience. And when the body becomes overwhelmed in that experience, it shuts down and freezes, and it will lock into that position. And the only way out is to be able to help the body release that squeeze and bring some pulsation and rhythm back to the body, have even temperature, even blood flow through the body, bring the body back to those core organs that would help us reproduce. So we need to be able to help the body recover from those states so that we can be more regulated and more at a place of being able to activate normal body functions.
Erica, in helping us put this show together, and we've had Erica on the show many times before, but I wanted to do a 1-hour special on this because fertility is the outcome, but really, if everything you do, even if you're not trying to have a child, you're going to heal your body today when you watch this show. Why was it important for you to bring an expert like Suzanne on to Bloom?
Well, infertility itself is a trauma. So aside from having any history of sexual assault or abuse or any of those kind of things associated with trauma, infertility itself, losses, failed procedures, the inability to conceive itself is a trauma. And so what I help my clients with is processing, with Suzanne's help, is processing those traumas on a monthly basis, meaning processing the trauma of not conceiving that month, processing the trauma in place. I call Suzanne's tools pocket tools for them, so that when they go to the restroom and they get their monthly cycle and they know that they're not pregnant that month, they can process it there in the moment and go back to their desk without stuffing that 800-pound gorilla back in its cage.
Very good. We literally have just seconds left. How many sessions would somebody need?
It really is, everything that I teach is self-activated and self-use. So once you have these pocket tools that you can use them in the moment of your triggers. It's not that there's a prescribed amount of sessions to heal for anything. I mean, we're just on a healing journey living here, right? So, these tools you can use anytime, any place.
I think it's incredible what you do. Thank you so much for sharing it with our Bloom viewers, and thank you, Erica, for the introduction to Suzanne. And you can read more about this story on bloomtampabay.com. We will be right back. It's time for today's Bloom trivia question. True or false? Infertility affects men as much as women. The answer is true. About 30 to 40% of cases are attributed to the male partner, with an additional 10% coming from a combination of the male and female partner. Well, thank you so much for tuning into Bloom today. You can catch Bloom anytime by following us on social media. We're on all major platforms, so get a behind-the-scenes look at all of the innovative breakthrough health and wellness conversations and incredible guests that we have right here on Bloom. And don't forget to check out our podcast, The Bloom Health Club. You can catch it live on Facebook and YouTube on Mondays at 2 p.m. We take a deep dive and have extended conversations with some of the top guests that we have right here on Bloom. Of course, you can stream episodes anytime on Spotify, YouTube, and Apple Podcasts. Well, we hope you'll tune in again on the next Bloom presented by Lifeguard Imaging. The shocking number of adults living with ADHD who don't know, and this could be linked to feelings of anxiety and depression. And find out why high-profile parents like Khloe Kardashian are turning to homeschooling.
My girl has been excelling, We're ready for school. We want to be ahead and confident and fabulous because that's who we are, right, babe?
I love it, Dad!
Stay healthy, everyone, and I will see you on the next Bloom.
Content segments during Bloom were paid for by Gulf Coast Rheumatology.
Call now 813-582-5222 to schedule your scan today.